Okay, I think we're on. It's setting up. Sometimes it just goes. So I'm just going to start it up. Thank you for coming on and watching Fertility Talks. I'm your host, Mary Wong, author of Pathways to Pregnancy, founder and director of Alive Holistic Health Clinic in Toronto. And I'm an acupuncturist and your fertility strategist. And tonight we are doing Fertility Talks number 159. And I'm so honored to have here with me two doctors, and I'll introduce them in a moment. But let me just talk about what we're going to speak to. And as you all are aware, coronavirus, everybody's talking about it. So we need to add in and really to look at general considerations, but also for fertility and pregnancy, because that's kind of being left behind. So let's talk about that. And so the goal is to disseminate and provide you the most up-to-date and accurate information as of tonight, which is March 18th. And then hopefully to dispel fear and decrease anxiety as you navigate this world the way it is right now. And so it was interesting. Dr. Baratz here, just wave hello. So he reached out to me over the past week and says, oh my gosh, Mary, we need to do a fertility talks on the coronavirus and fertility. And I'm like, absolutely. And I had the honor and privilege of having him on our show for live post number 148. And for that, the topic was on positive pregnancy, now what? So this is a great segue into, now we're into the now what, and here we are discovering that there's coronavirus and what do we do now? And so here we are. And before we continue, I wanna first of all, introduce Dr. Baratz more formally. And so Dr. Ari Baratz is a reproductive endocrinologist and infertility specialist at Create Fertility Center. He's a compassionate practitioner and dedicated researcher who has presented his research at several national and international forums. Dr. Baratz has a special interest in reproductive telemedicine, Ontario Telemedicine Network, consulting with patients across the globe. And so thank you for being here and thank you for suggesting us to do this tonight. And I also want to thank you for inviting Dr. Yoel Abells. And I'm so thrilled to have you here. I read your bio and I actually Googled you and I found a little talk that you did and you're brilliant. So I thought that you're a great asset to this conversation. And so thank you.
Thank you. Thank you.
And so to let you all know who Dr. Abells is, he's the current medical director of the Forest Hill Family Health Clinic in Toronto, and with a special interest in women's health and family practice obstetrics. He's also a professor in the Department of Family and Community Medicine at U of T, that's University of Toronto, for those of you who do not live in Toronto. He is the medical advisor on Global, or was a medical advisor on Global, and wrote weekly health columns for the Post. So no stranger to spotlight. So this is great that you're here. Now, what I found interesting was that you, Dr. Abells, were part of the committee called Family Physicians Toronto that helped provide leadership and direction for the community-based response to SARS back in 2003. And now, more importantly, you are setting standards for COVID-19 policy for family medical doctors in the Toronto area and sits at the Family Medicine COVID-19 Toronto region table. So I am thrilled to have you here. And so we're gonna kick this up a notch and hopefully cover everything that everyone needs to know. And although this is on Facebook Live, I don't think I am actually privy to people's comments while we're taping, because we're also using Zoom, this external thing. So what we can do is maybe address some of the questions after. And in the meantime, I, of course, have questions for you both. And I guess the very first thing is we got to talk about coronavirus 101. So let's do a little bit of a basic introduction. What is coronavirus, Dr. Abells?
Before I start, I just want to correct one thing. I'm an assistant professor. I don't want to take too much credit, and I'm serving on the advisory board. I'm not doing quite what I did when I was doing chair of Family Physicians Toronto, but basically the coronavirus is a virus, and how viruses are different from from bacteria is that viruses basically enter the cells of the human body. And then that's what allows them to survive, to replicate. So the important message from that is, firstly, that antibiotics will not touch viruses at all. And in most viruses, the body is able to handle. And in fact, even with the COVID, we're seeing that the vast majority of people are able to handle the virus. They're able to get to ultimately heal from it. What happens, unfortunately, is with some, because this particular virus enters the lungs, it can cause a pneumonia. And that pneumonia can be quite severe, and it can lead to critical illness. And in rare cases, really, when you look at the numbers, in rare cases, to death.
And I love it how you actually mentioned can, because it's not necessarily so. And I want to address this because I actually went to the playground with my daughter, and we were one of two people there. And the lady herself, we were talking about the coronavirus, and I said, well, not everybody will die from it, right? And she was actually shocked. So I don't know what people are thinking out there, but we really want to dispel some of the myths, right? So any comment, Dr. Baratz?
Well, many people ask, what is new about the coronavirus? Like, what's the big deal? We have hundreds of thousands, not millions of viruses on Earth, and yet we talk about this coronavirus. The problem with coronavirus, as opposed to the previous coronaviruses that we've dealt with, like SARS or other viruses that we're familiar with, like influenza, is we understand them a little bit more. We don't understand coronavirus. We don't know how long it hangs around for. We don't actually know how long, what its half-life is. When will the season of coronavirus stop? We know every year influenza comes and then it goes, right? Whereas with coronavirus, we're still learning. That's why they refer to it sometimes as the novel coronavirus, the new virus, which I believe the SARS battle and the MERS battle and the other viruses that we've dealt with in the corona family have helped us prepare for this. And that's why I think we should have confidence. Our knowledge, and Dr. Abells referred to 2003. I'm not sure if he remembers, but he was my professor when I was doing obstetrics back at Mount Sinai in 2003. And that was really a novel time. We were using masks for the first time, the N95, no one even knew what that was. So our knowledge of virology and the biology of the virus has improved vastly over the last almost 20 years.
Anything to add in, Dr. Abells?
Now that he's dated me quite some no. Well, I absolutely agree that the point is that we are well ahead of where we were in many ways. We're well ahead in terms of our knowledge of viruses in general, in terms of the technology that we have available to analyze things more quickly, so that we can, once we analyze the particular virus, then we can figure out how we can attack it and how we can destroy it, or how we can prevent it through vaccination. So in that sense, we're very far ahead. Certainly the hospitals are miles ahead of what they were like when in 2003. And the community-based response is much better than it was. We've lagged a bit behind. Some of it is because we've become a bit complacent, but we certainly have moved in a way that we didn't move with the SARS.
So we're ahead of the curve. So that's a great thing to know. And so in terms of knowing about individuals that are already immune compromised, so the elderly population, we want to speak now specifically to those that are trying to conceive or those who are pregnant, whether it's early pregnancy or later in pregnancy. Did you want to comment on this, Dr. Baratz?
Absolutely. I mean, that's one of our big concerns.
Exactly.
So as per what Dr. Abells mentioned, that even though many, many people will come in contact with coronavirus, very often when they talk about number of people affected, like as of 3 p.m. today, I checked the stats, and there's been 215,000 people worldwide affected by coronavirus, even though that's probably an underestimate because we don't actually test everybody. But the percentage that will actually have serious illness and death is still a relatively small percentage. It's somewhere in around the 2 to 4% range. And usually these people are in their sort of 65, 70 plus years of age. And we know that as they get older, the severity of the illness increases. So here's the problem with pregnant women, which is they're typically not in that demographic. that you would typically associate severe illness with, except for the fact that they're pregnant. And pregnancy is one of these, what we refer to as immunocompromised states. These states where the immune system is just not the same as it was when the female was not pregnant. And typically, if you're at a cocktail party and you're pregnant, you're the person that's going to get the cold in the room. You're more susceptible. And I guess in this, well, we don't have cocktail parties now because of the new coronavirus policy, but they are women that will, if they are at risk for a more severe illness, and that's the big concern. The reassuring piece is as this virus has moved across the globe, we've seen through reporting, selective reporting, that pregnant women are particularly getting more of a mild, moderate version of the coronavirus symptomatology and disease. And we're not really seeing the severity that would be associated with death. So death, as was mentioned, is usually respiratory. People go into acute respiratory distress, and it's typically the lungs that cause them problems. And so we know that in China, which was the first country reporting on this, they've reported 60 pregnancies that have been affected by coronavirus. Now, just to give you perspective, there are about 30,000 births in Canada per month nationally. So there must be many, many more births per month in China, and we're only reporting on 60 pregnancies. So now I'm sure these numbers will change. So far, most of those women have had mild to moderate disease. There's been only one case of acute respiratory distress, that severe lung illness that was described. And there's been only one case of a fetal death that was described. Now, I'm working on very small numbers, and that's the other challenge with coronavirus reporting is that it's all about case reporting. It's not large populations. But I would say for the most part, that's reassuring for us as providers.
And Dr. Abells, I'd love to hear your insight on this as well, since you deal with pregnancy.
What I do recall with SARS is that many of the women who were quite sick were the pregnant women. Those were the ones that we saw who were intubated. Again, I believe that it's a different disease, and we're ahead of the curve in terms of the approach to the disease, our the way we react to a pandemic in general. So in very general terms, my experience so far has been I have not had any pregnant women with any symptoms, frankly. Many pregnant women who are afraid, but not any with any symptoms of concern, not even colds, frankly.
Oh, okay.
Yeah,
yes, Dr. Baratz.
So one of the issues is also that when you talk about virus, it's a very general term, right? We're familiar with influenza virus, the coronavirus, the Zika virus, H1N1, and they all have very different impact. I mean, the Zika virus was the last big virus that was concerned in pregnancy, and that had a very severe morbidity and fetal mortality. These babies that were born, it was catastrophic, what we were seeing coming out of South America and that surrounding area. Zika is a very, very different virus than corona. These are different breeds altogether, and we are not seeing that impact on the fetal side of things. We believe this is primarily a maternal lung issue. We're not seeing significantly more miscarriages, or there's a term we refer to as teratogenicity. Teratogens are things that affect baby development. We really haven't seen that as yet in the last 6 months.
Right. So from what I've read in terms of the case reportings, there had been no impact on in fact, not even transmission to the babies for the most part, right?
Yes, there's only been one case of a baby that's been recently born in London that showed COVID-19. We do not believe that there's what's called vertical transmission from mom to baby via the amniotic fluid. Coronavirus is an aerosol, it's an air-based passage of transmission. It's not through blood, it's not through semen. So we're not, and that touches on the fertility treatment. So we're not really worried about it being transmitted that way. It's more via air droplets and respiratory.
So I had just watched another documentary through another physician, and he was talking about how the virus can stay on surfaces, right? So what was it? Plastic and stainless steel, it could go up to 72 hours. and cardboard, 2 days. So how will that cause transmission?
Well, I think we have to be less, we have to be less concerned about where it stays and what we can do to prevent it from getting to where it might stay. I think that's really the important message. Whether it stays for 2 days on cardboard or 17 days on ceramic is irrelevant. What's more relevant is what can we do as individuals to prevent it from getting there in the first place. And that's really the important message. We should be focusing on the kind of things that really we should be focusing on even before the coronavirus came. So proper hygiene, washing our hands properly and frequently, making sure that we are sneezing or coughing into our not into our hands, but into our elbows. The idea, because what typically happens is people, they don't understand that when you're doing that, and then shaking somebody's hand, even 10, 15 minutes later, you're passing it on. And certainly not sneezing in front of someone. And most people don't do that. Actually, the ones who do that the most are kids. And that's why kids are such important vectors for this, and why part of the rationale behind, for example, when we have the flu shots, focusing on making sure that kids get it, as well as those who are immunocompromised or the elderly. But the reason we want kids to have it is less to protect them and more to protect others. So it really is it's less about where it's going, and to me anyway, and more about what we're doing to prevent it from getting there.
Which is all the basic stuff that we've all
Absolutely.
been talking about already, right? Dr. Baratz, did you want to contribute to this conversation?
Well, there's a term that's floating around a lot, which is social distancing, which we all talk about. And Dr. Abells was referring to part of it. And we all know that provincially, nationally, we've really created a new normal. I actually like to refer to it as the new abnormal, because I don't think social distance really makes sense in our current society. But it is interesting how etiquette has changed. I mean, in my practice, up until very recently, when I would congratulate someone on pregnancy, there would be a handshake or maybe a distant hug. And just recently, a patient came into the clinic and said, "Dr. Baratz, we did it. I'm pregnant." She gave me a shot on the shoulder. She tapped my shoulder. And all of a sudden, everyone turned around and said, "Oh my God," like a gasp. Like physical contact has really become not part of the new etiquette. I just had a niece born 4 days ago, and I met her for the first time just by chance, because they were going somewhere. Like we're not even allowed to come in contact. Everyone's really become very socially distant, which I think right now is very appropriate, which we may talk about later in our interview about how we deal with that from a mental health perspective. But I think that's really been very impressive to me, how everyone really has adjusted their etiquette along with Dr. Abells' lines. Dr. Abells was saying how that's really how we deal with the incubation period, is we respect the virus and say, hey, it could be anywhere. I don't care how long it's going to last. I'm not going to cough my hand. I'm not going to hug and kiss. I'm not going to shake. I'm going to keep my distance. One other point is, when we talk about incubation period in virology, because that's a big term that's used in the media, we're referring to how long is the virus hanging around when you may or may not be symptomatic. Because when you're symptomatic, we know, like when you start having cough, fever, respiratory distress, you know to stay away. But that's the tricky part with COVID-19, is it could be up to 14 days, right? So that's 2 weeks you're walking around and you have no clue that you're shedding virus to everybody.
Yeah, I'm actually in self-isolation, just so you all know. I came back from Disney World.
you look great, Mary. You look great.
Yeah. We had a lot of fun. So it's a choice for sure. And so then I guess that kind of answers the question about, how risky is it? So, people are doing social isolation and social distancing, but here's the truth. People need groceries, and I've gone to the grocery store and they're packed. So, if you're saying before it was, you should be in a crowd less than 250, and now it's down to 50. I don't know what it's going to be in the future. So how do we navigate going to the supermarket, going to the fertility clinic, going to your doctor's office? Dr. Abells?
Well, first of all, what we're doing in the office is we've taken seats from in between seats, and we've spread the seats out so that there's quite a gap between between individuals. We've lined it up so that when the patient comes, they are at least, they're probably close to 2 meters away from the office staff. We are trying to see less of them and deal with them either virtually or by phone. We're also spacing them so that we're certainly bringing the quote healthier ones earlier in the day and the sicker ones later in the day. So we're trying to space things out. That also has influence on whether you wear or don't wear protective garb, which is another issue. But I feel that I mean, I've had patients telling me that they're afraid to go outside, and I encourage them to go outside. I think we're not saying isolate yourself so that you become hermetized. We're saying be careful. We're saying maintain a distance. We're not saying don't go outside. When you go to a shop, if you're the best thing is to try and go earlier in the day or later in the day. The truth of the matter is that now, anyway, you go to many of these stores and there aren't many people, so you can maintain social distance. I think the bigger problem, frankly, was 2 weeks ago when we would close some things but not close other things. One of the physicians in my office, well known to Dr. Baratz, actually, because she's his wife, said she's wondering what's going to happen now that we're chasing everybody out of their work by having them work at home. They're all ending up in the supermarket, congregating there. She also made another interesting comment. It'll be interesting to see what happens over the next few months in terms of divorce or increase in production, because some people living together after working together, it may be interesting to see the impact in a funny way. Although I'm concerned about the impact from a mental health standpoint, quite frankly.
Absolutely, yeah. I'm actually concerned about people's mental health as they isolate themselves as well. Yeah. Dr. Baratz, would you like to comment?
Well, the fertility clinic is an excellent example, much like the family practice clinic, where we are providing a mixture of essential and non-essential services. And so part of the approach has been obviously patient safety, making sure that everyone is as safe as possible. Provider safety, that we have to protect our clinic. So we do have a station when you enter the clinic that screens everybody just like a hospital. And we also manage differing levels of comfort. So there are some patients that do have a general level of anxiety or concern that is not allowing them to function. So we've been allowing some of our staff to take leave essentially and not have to work in the environment. Fortunately, volumes are down as per what Dr. Abells mentioned. And I think that volume reduction is a good thing because it helps protect everyone involved. But it is important to remember the province is not closed, right? Grocery stores have to stay open. Transit needs to be available. And I think one of the sayings that really is very applicable here, and I've been thinking about it for a while, is perfection is the enemy of good. We don't have to be perfect. I mean, in a perfect world, we would all have 6 feet away from each other all the time, and there would be no breach. But that doesn't exist. And so if you look at some of the modeling that the clinical epidemiologists have provided, they have different models that show a complete lax society where there are no rules in play, a society that's very rigid, and then somewhere in between. And the somewhere in between provides almost as much flattening as the more rigid approach. So I think the Canadian Ontario approach has been very appropriate, definitely ahead of the curve from other countries. And what's impressive to me is watching the compliance, because yes, there's been breaches, but a lot of people are respectful of the current state.
That's us polite Canadians. That's what we do. Okay, so then why don't you, since you're on a roll, Dr. Baratz, I know Canadian Fertility Andrology Society sent out a note this evening at 6:30 p.m. Can you go through some of the new guidelines or the most current guideline at present?
Well, first of all, the term guideline usually refers to a vetted, evidence-based document that's been looked at over a long period of time. And so many of the documents that are coming out, I think, are what we call soft guidelines, because everyone's reacting. No one knows the universal truth, and everyone's doing what we believe is best practice. One of the challenges that our Prime Minister said is that we need a single message. And that's been one of the challenges, is that there's been messages coming from many different bodies that are for the most part aligned, like that are coming from the Premiership, from the Prime Ministership, from the College of Physicians and Surgeons of Ontario, from the Ontario Medical Association, from the Canadian Fertility Society, the American Society. So every day, every pretty much 3 hours, I'm receiving 6 emails from 6 different bodies trying to align themselves. And so to put together those guidelines, I would say that some of the common themes are: number one, limit the number of people that you are treating, essential services. Number two, specifically to fertility, complete cycles that are ongoing. So if you, for the fertility population out there, they're very aware that a cycle is not just like a one-day procedure. It may involve 1 or 2 weeks of preparation. So any ongoing cycle should be completed. And
wait, I want to cut in then just for that moment. Okay. So for example, so sometimes people are doing a long protocol, and if they're being like down-regulated with just something simple as a birth control pill, is that considered you're in the cycle and you can go forward, or would you cancel that?
So I think you're asking an excellent question. So some of those decisions would have to be relegated to the specific provider and the patient. I don't mean to be overly diplomatic, but the truth is that obviously if it was a very young, good prognostic female, perhaps extending the birth control pill or starting and stopping and waiting a couple of weeks to see how the entire situation settles might be more appropriate. I think if you had a woman who this was her last IVF cycle, maybe later in her 40s, one might consider continuing. The guidelines are recommending that reproductive age should not influence continuation of care. That did come out at 6 o'clock this evening. But again, all of these guidelines are given as a recommendation, and individual clinics really do have to engage patients and make final decisions. But to finish my point, I think that you should be freezing as many embryos as possible, pushing off cycles as much as possible, and alleviating fear as well. Any early pregnancy, patients should realize that is not grounds for termination. There's no data to suggest that the baby will be compromised in any way. As we said, it's not a Zika virus. But again, the general theme is do what you need to do and try and limit the number of people that you're treating.
Dr. Abells, any comments?
I couldn't agree more. I mean, we've said it, both of us have said it a number of times. The issue is really about, we can't stop providing care to patients. And just like we can't stop breathing, we can't stop working, we can't stop going out. But we have to be sensible in the choices we make. And we have been able to really, I mean, you go to our office now, at times it really looks as though it's a ghost town, because yet we're treating patients ongoing through other means. And because we're also taking patients in quickly, seeing them, dealing with their issues, then there's none of this overlap of patients that you might see in a regular office. There are things we have to do. I mean, babies require immunization. We need to make sure, what I'm doing, for example, is the visits that are not for immunization, but just to see how they're developing, those I can handle over the phone or over the video, because I can see if a kitty is developing well. I can't tell a patient who is 36 weeks pregnant, we'll see you in 4 weeks, because that's when the whatever will be lifted. So I have to see them. So I have to coordinate it in a way. We have to coordinate in a way that gives them the comfort, because some are afraid, the comfort of knowing, don't worry, you're coming in at time. There's nobody going to be around, and we'll see you promptly, and then you can leave.
I think that's a really great way to manage the patients. And I hope that those of you who are watching, whether you're just trying to conceive or are pregnant, have this be your way to dispel your fears. And let's see. So then let's go to, what do we do in general? Okay, Dr. Baratz.
Right. But there is sort of a silver lining, at least with fertility treatment, which is, I don't want to in any way downplay the expectation of starting a cycle and all the energy that goes behind that, both medical, emotional, and financial. But the nice thing about fertility treatment is that the recovery is very rapid, meaning if someone decides to delay their cycle, typically clinics can handle that surge in treatment within 4 weeks, right? So we're not talking about like a surgical delay in the main operating room where that could be months and months until your operation is occurring, right? And, worst case scenario, if someone does have to go through treatment in the fertility clinic, because the downtime is so minimal, one isn't being exposed to the hospital environment, which we believe is more high risk. So fertility patients are in some ways privileged because they typically are in that better prognostic age group, that demographic that's not going to be severely affected by COVID-19. And we have, at least in Toronto, we have enough providers that access to care really should not be a barrier. I cannot say the same for other areas of medicine. It is very difficult for my colleagues that work in areas that are underserviced or certainly hospital-based. Is a complete, it's a mess right now. I don't know how they're going to triage all these cases that are being canceled and delayed.
Mm-hmm. Okay, so this is actually raises a really great point. So there is the concern about having newly pregnant women or in the future having to have more medical care and may not get the care that they would need if they need to go to the hospital, right? From the overcrowding of people with COVID virus, the coronavirus.
I would like to argue that we're not at that point yet.
Oh no, absolutely.
I have not felt in any way that women are at risk of not getting the care they need. Whether it's for high risk or for low risk, frankly. We're still able to access imaging if we need imaging. We're still able to, as a family doc, if I need a consultation, they're there. I'm in fact, I have a patient in labor right now. I have a patient in labor right now, and I know that everything is being handled. They're comfortable. We're not trying to create a sense of crisis, just a sense of calm.
That's really great input because, of course, there is that fear going around right now. So I love it that you're adding this piece in. So again, for those who are pregnant, just know that you will be taken care of, right?
If I may, the problem, there's a few things I keep saying to people. If we panic, then we get confused. And if we get confused, we make mistakes. So we really need to be calm about these things. And my office manager said this is something of a nightmare. And I said, no, it's something of a challenge. So that's the way to look at it. We need to move forward with life. We can't stop living. But we also need to recognize that, and I don't even like the term new abnormal or new normal. It's hopefully just a transient state. Hopefully we'll learn from it. But I do feel we're at a state, certainly in the hospitals at the moment, where we do not have to worry about the ability to take care.
Okay. And that's for the current situation. And then how about for the future? I mean, that's why we're working on flattening the curve, right? So what happens if we're like Italy? Just hypothetically.
Well,
Dr. Abells.
I guess hypothetically, the worst case scenario can happen. But when for example, one of the MPs from Northern Ontario, who happens to be an emergency doctor, calculated how many given the number of patients we have, given the number or the relationship of the number of patients who require intubation to the number of patients who are sick, in his area, he felt they might need up to 50 machines, whereas ventilators, and they only have about 28. But what the government has said is we have the money and we're buying that equipment. And hopefully they'll do that, of course. So I think the reserves are there.
Okay, great. So again, I love it that you're addressing this because, media is a love-hate relationship I have with them because I find that they can, media is all about, it's not necessarily putting fear into people, but it just dramatizes and accentuates, right? So I think it instills more fear. So I really want people to watch this so that we can dispel some of this fear. Dr. Baratz, you want to comment?
One of the things that was mentioned earlier on, we talked about our memory of SARS, but it's almost analogous to the immune system itself. The immune system gets stronger as it gets more experience. And so our immunity or our response to the COVID-19 is stronger because of our experiences in the past. And SARS Canada was a touchdown point for SARS. Downtown Toronto became one of the leaders in response. The past government has prepared for this. I think what you're seeing in other parts of the world is not so much just a medical phenomenon, is a geopolitical government phenomenon. Italy, I don't know all the ins and outs of that country, but I know that the issues there were pre-existing SARS. Its infrastructure was in trouble before that. And the staggering number of deaths that you're seeing there, much greater than other countries. It's like comparing apples and oranges. It's a different population. It's a different geopolitical setup. And so not that I want our neighbors, the golden rule, I want everyone to be treated like we're treated, but we're very privileged. We have a country that has the right mix, the right population mix, the proper infrastructure, the proper planning. Even today, the announcements made by Ontario and the federal government in terms of federal support, financial support, was incredibly impressive, probably much better than anywhere else in the developed world.
In the world, yeah.
Which leads to the part that we're probably going to talk to as well, which is the mental health and the anxiety. COVID aside, if someone's business is going down, it's very difficult to curb that with just hand washing and social distancing. So I think that's something you might want to visit, either yourself or Dr. Yoel. How do we deal with that part? How do we prepare people for the fact that there will be a tomorrow? Because COVID-19 will go away eventually.
100%.
How will we recover from that?
Dr. Abells, do you want to take that on about the mental health aspect?
That's the difficult question. Mental ill health has been an increasing problem over the past few years, and we haven't had the kind of infrastructure to deal with it. I often say that when I first started in practice, maybe 10 to 15% of what I saw was directly or indirectly connected to mental ill health. And now I almost jokingly say, but not tongue in cheek, but not so much so, is that maybe 10 to 15% isn't. Or I have said I'm late to a meeting because 7 people booked for hangnails, and it turned out 6 of them were depressed. So I do think that this is going to create a great deal of anxiety, especially amongst those who are already vulnerable to that. And I think it will take an initiative that goes beyond what is being talked about now. Now we're talking about the acute. We're not talking about the long term. And I think that we are going to have to turn to government and say, we need more help in terms of the kind of infrastructure, mental health infrastructure, that we've needed actually for the last 10 or 15 years, but even more so now, because I wouldn't be surprised if we see an increase in people who are severely depressed, severely anxious, who may have been on the precipice before and now they've been pushed over. And I'm not looking forward to that time, in part because we're already feeling as primary care providers that we're failing many of these patients, quite frankly. So, I wish I could say something exceptionally positive. I can't. I'm concerned about that.
Yeah. Dr. Baratz?
Well, I do have something positive to say up to that point, which is that we have had similar experiences. Like SARS was our best example, and we got through it. So, if someone has a comorbid issue with mental illness, it's likely deeper than the COVID-19, and correct, we won't be able to cure it with this. But I do believe that we will persevere. Certainly on a fertility perspective, many women are worried and anxious, particularly now about their pregnancies. I can never tell someone everything will be fine, but I have a very high nexus of suspicion that things will be fine with their pregnancies. There's no indication that the surveillance has to change in any way. So most of us will do well, which should be reassuring for most of us. And those that are on the fringe, well, they will need to be close with their primary care providers and their fertility specialists to get through this. As per what Dr. Abel was saying, a lot of my conversations with patients have not been about hormone levels or gonal F dose, or egg retrieval date. They've been more about, like, am I going to be okay? Is my baby going to be okay? are we going to get through this? Like, is society crumbling? That part of that sort of human connection, showing people that you're there to talk to them more than just about their actual fertility issue, other things, I think has really gone a long way in the last couple of weeks.
So absolutely, you're more now, everyone has to step up in the primary care to not just be there as a practitioner helping people with their physical ailments or physical challenges, but really addressing and acknowledging the mental health aspect. So I really love it that you're both addressing this. And what I do as an acupuncturist, we actually see this all the time. And when people come for acupuncture, I'm like, you know what, a technician like Dr. Baratz, you can do acupuncture. I can teach you. But it's how we be and how we connect with the patients and the rapport we create. That kind of bond is so special, and that in of itself can be uplifting and healing, as we know in the science of epigenetics, right? Our environment and how we be with each other, that impacts our health and well-being too. So, for those that are watching, and if you are in a place of, gosh, I'm feeling a little depressed or anxious, you just also need to find a community of practitioners that can be helpful. You were going to say something, Dr. Abells?
Well, I was going to say something.
What I was going to say is, if we have a very important role as family physicians, it's to connect with our patients, because they do look to us for support. They do look to us for comfort. And that's why I think we all have a social responsibility to stay open as best we can and to continue to provide care. Because the message we're sending then is, it'll be okay. And we're here to listen to you. We're here to help.
Yes, absolutely. Thank you for putting that in there. Dr. Baratz?
For the record, I have done acupuncture before. I'm an egg acupuncturist, because when we do ICSI, we push a needle right into the egg. And that's very much like acupuncture, right to the lemma. So thank you for that confidence. I can only do one needle at a time. I can't do the whole meridian.
Okay. All right. So again, I mean, most of the people that are watching will either be health professionals or people that are specifically trying to conceive or are currently pregnant. So I would love to hear from both of you. I'll start with Dr. Baratz in terms of what's your last words of advice for this group of people as we are going through this.
Well, we've said so much, but I would say follow the recommendations. Try your best to maintain social distance until otherwise instructed, and stay in touch with all your with your network, with all your loved ones, because they do need you. You need them, and they need you. And be responsible. If you need to self-isolate, that really is a reflection of the golden rule, treating others like you'd want to be treated. And if you're not sure, ask questions. There's many resources out there in terms of the COVID-19 assessment centers, all online. Those would be all my best advice.
Thank you, Dr. Baratz. Dr. Abells?
Well, he's taken most of the words out of my mouth, but I really think we need to understand that this too shall pass, and we will be okay. And then we have to move forward. And beyond that, it's in God's hands or whoever's hands. But what will be will be. We'll be fine. Really, will be fine.
And I would like to add in, I think we are already fine, and we all still will be fine.
Right.
Very good.
But
Absolutely.
If it is in God's hands, he better wash with some alcohol-based Yoel or soap and water for at least 2 minutes. Okay.
Great
She better wash.
He or
yes.
she.
Thank
Correct.
you.
Correct.
I like that.
I'm a father of 4 daughters. I know where I stand in the world.
Absolutely. Yeah.
Mary, thank you so much for hosting this platform. I think it was very helpful. I always enjoy hanging out with Dr. Abells and you. So thank you for all the good work that you're doing.
Thank you both for coming on. Yeah, it was fun. And, more than fun, we are hopefully going to make this, our message will be received far and wide, and that will make a difference. And again, to dispel the fears that are going on, and let's just live normally, but, self-isolated.
Normally, but carefully.
Normally, but carefully. Yes, very good. and wash those hands. And you know what? I think one of these days I'm going to create a video on what actual hand washing for 20 seconds look like, because you have kids and they don't love to wash their hands, right? So, you know, I would love to do that for kids, actually. That would be great. Okay, thanks guys for watching. And if you have, oh, you wanted to say one more thing, Dr. Baratz?
No, I just want to say bye.
Oh, okay. Well, premature bye, but I just want to quickly announce. So like this, share it with all your network, because this is an important conversation. And like I said, we want to share this widely. Okay. And go ahead and check out my Mary Wong Acupuncturist YouTube channel. It's going to be uploaded there. If you're watching this on Facebook right now, like the page, and you can scroll down below. You'll find Dr. Baratz's interview from, I think it's live post number 148. Yes, 148. And I see that we'll have other fertility talks to come with you, and perhaps with you, Dr. Abells, if you will have come back. Sure. And yeah, great. So thanks guys for watching, and please feel free to reach out to me, MW at aliveholistichealthclinic.ca, for more questions. And if you have any recommendations on what you would like to see, I would be willing to look at that and create new fertility talks for you. Okay, so have a great night. And that's it. We'll talk to you guys soon. Thank you both again for coming on. It's been a total privilege.
Bye-bye.
Bye, guys.
Take care and be safe.
Bye-bye.
Bye-bye.
Yes, you too, everyone.